Hello everyone, this is Leanne Kaiser, and this is current event number 2 for MHA 575, entitled Social Determinants of Health. This was from a Forbes Technology article on February the 12th, and the title was How the Biden Administration Can Prioritize Social Determinants of Health in the First 100 Days. So I thought this was very relevant given the fact that President Biden was just elected and he's already discussing social determinants of health. So we know that taking good care of ourselves by practicing good eating habits, getting enough physical activity, not smoking or not doing drugs, getting recommended health screenings and immunizations, as well as seeing a doctor when you're sick, all influence our health and well-being. However, our health is also determined in part by access to social and economic opportunities. So when we talk about social determinants of health, according to Healthy People 2020, health starts in our homes, schools, workplaces, neighborhoods, and communities. And so I think this is very powerful that we think about our health as a whole and everything that impacts us. So this is a very interesting slide that points out the previous conversation we just had about social determinants of health. So if you look, all those factors in the surrounding bubbles impact what we do and how we are. So social determinants of health, defined by the World Health Organization as the conditions in which people are born, grow, live, work, and age, which are shaped ultimately by the distribution of money, power, and resources. So conditions in the places where we live, learn, work, and play affect a wide range of health risks and outcomes. Ultimately, these conditions are known as social determinants of health. So, lots of impact here about all aspects of our care. So again, when we talk about the social determinants of health place, we talk about things like school, church, workplace, and neighborhoods. So conditions in these various environments and settings, the school, church, workplace, and neighborhood, are referred to as the place. In addition to more physical aspects of the place, the patterns of social engagement and sense of security and well-being are also affected by where people live. The resources that enhance people's quality of life can and do have a significant influence on population health outcomes. Understanding the relationship between the population's experience, place, and the impact of the place on health is fundamental to the concepts of social determinants of health, including both social and physical determinants. So when we think about social determinants of health, we think about the things on this slide. So the availability of resources to meet our daily needs. So we talk about food, access to food, those types of things. Access to educational and economic and job opportunities. So, do you have the opportunity within your community to have a meaningful employment, a job? Do you have access to healthcare services? So are there clinics locally in your communities? Quality education and job training. So do the schools that you attend have the appropriate level of opportunity to access things like job training? Can you receive the appropriate level of education to fully graduate from high school and be able to sustain a job? Availability of community-based resources in support of community living and opportunities for recreational leisure activity times. So this is very important in urban areas. Is there availability of a community center that kids can go to or that adults can go to for recreational activities or leisure time activities? So this is kind of what we would, some would call the green space. Do you have any area to get away and get any exercise, to get away from the stress of everyday life and be able to have those opportunities for recreation and leisure? Transportation options. In urban areas, obviously transportation is typically not a problem. They have lots of things like, bus lines, and, in some cities we have, trains and those types of things to be able to get from one area to the other. But this is really a huge issue in rural communities, such as Southern Illinois. There isn't as necessarily as many public transportation opportunities that the communities have in rural health areas, and it becomes solely lies on the individual having a working operational car, and some folks in rural communities don't have that. So in our areas, especially in Carbondale and the surrounding communities, West Frankfort, Marion, there aren't public bus lines that can take you from community to community, or even take you from your home to a grocery store. So that's a large concern. Public safety. So, do the folks feel safe in their communities? Do they feel like their lives are threatened when they're outside, and so therefore they can't be outside to be in those activities of community leisure and recreation? They don't feel safe in their communities to be able to go outside because maybe there's gunfire. Social support. So are there communities that can have things like soup kitchens, or things where they can go and get groceries. Maybe that's food pantries, those kinds of things. Social norms and attitudes. So what's it like in their communities? Are they considered to be flourishing in their community? Or is it community support? Is there is there a very negative tone in their communities? Is it all bad in their areas? The exposure to crime, violence, and social disorder. So this is what we talked about a minute ago. When they step out on their front porch, are they fearful of, a gang shooting and being shot by a drive-by? Where they feel like they can't walk to the grocery store because they feel like they will be hit in the crossfire, or maybe they'll be attacked in an act of violence. Socioeconomic conditions. So is the area that they live in very downturned? Is the housing not appropriate? Is it not up to standard? Residential segregation. So do they feel like their communities are segregated from the rest of the world? Do they feel like that they're included in other activities that are being held across the country? Language and literacy. Do they speak the same language of all the information that's being put out there? So, for example, if they are Spanish speaking, is only the information that's being put out in English? So do they have the literacy to read or write, or do they understand the language that's being spoken to them? Access to mass media and emerging technologies. So do they have internet connectivity? Can they get online to be able to sign up for programs such as what we're seeing right now with COVID-19? A lot of those vaccination clinics you need to be able to either call in. Do they have a phone to be able to call in, or to go online to schedule their appointments? And then culture. So what's the overall culture of their community, and how does it support the use of medicine, or is it anti-medicine? Some cultures don't believe in Western medicine. So is that how they live, and is that how they've grown up? So the physical determinants of health is the natural environment, such as green space or weather. And we talked about that a minute ago. Green space, do they have a park near where they could run, or where they could feel like they could get fresh air? The built environment, such as their building, their sidewalks, their bike lanes, their roads, that's, important. Do they have the appropriate surroundings for them? Their work sites, their schools, their recreational settings. We talked about that earlier. Do they have the ability to go to a school? Can they get to school? Do they have busing? Can they walk to school? Their recreational settings, their housing in their community is designed. So is the housing appropriate for those folks that live in that community? Do they have a sense of community, or are they very much lonely? Their exposure to toxic substances and other physical hazards. So, are they living in an area where, maybe the water is not safe for them? And we've all seen on the news where some of these cities, the water has been deemed unsafe. So do they have, other physical hazards that are certainly impacting the areas they live in and their health by drinking what may be coming out of their tap? Their physical barriers, especially people with disabilities. This is something I think that the city of Carbondale has really gone a long way with. Are the sidewalks wheelchair friendly? And I know, Carbondale was received some awards for the ability to have a disability friendly city. And then the aesthetic elements. Does it look safe and pretty and attractive for someone to live in that community? So here's a graph kind of that talks about the overall social determinants of health. We talked a little bit about kind of the different aspects, but this kind of puts it all together. So the economic stability, meaning is there gainful employment? Can they get a decent income to live? Do they have a lot of expenses? Can they cover their expenses of food and water and rent and electric and those kinds of things? Do they have a lot of debt? Is that something where because they have so much debt, they can't get themselves out, pull themselves out to be able to live a reasonable life? Do they have a lot of medical bills? So maybe they were seeking care and had no health insurance, so their medical bills are overwhelming and they can't necessarily, make it, the way they need to. And then support. Do they have economic support? Do they have, job training centers? Do they have community centers that are helping them find gainful employment? So neighborhood and physical environment. So do they have appropriate housing? Is there transportation? Is there safety? Is there parks, playgrounds? The walkability level of being able to get to everything they need. Can they walk to a grocery store? Can they walk to a pharmacy? Can they walk to a health clinic? So meaning zip code and geography, it plays a huge impact in social determinants of health. Education, meaning literacy. Can they read and write? Do they understand the English language? Because, we all know that is primarily what information is put out there in English. And in some of these communities, yes, it is put out there in other languages, such as Spanish and those types of things. But primarily, the mass media campaigns are a lot in English. Early childhood education. We know that obviously, if kids get off on the right foot with schooling and education and early childhood opportunities, then they're much more successful. Vocational training. So do they have the opportunities to learn a trade or a skill rather than seeking out higher education such as college? These areas need, we're seeing more and more in the news that we need vocational training. We need carpenters, we need plumbers, we need electricians. So are they given those opportunities to learn those vocational trades that will help them with that economic stability that we talked about a moment ago? Food. Do they have? Are they hungry? Do they have insecurities in food? Are they unstable in their food source? Do they have access to healthy options? So do they have options of fresh fruits and vegetables, or is their only option McDonald's because they can get something off the dollar menu and that's all they can afford? They can't afford the greater expense of fresh fruit and vegetables. Community and social context, the social integration. Do they have support systems? Do they have community engagement? Are they feel like they're being discriminated against because of the color of their skin or the language that they speak? Do they feel like they're immediately being turned down for opportunities because of that? And then the overall stress associated with that. Do they feel like that, because of all those impacts, that they're under undue stress and large amounts of stress, which is impacting their health? And then their healthcare system. Do they have health coverage? Are they covered under a regular health plan that's through their employment? Or do they have opportunities for Medicaid or Medicare? The provider availability. Are there enough providers in their community to take care of these patients? And then we talked about earlier, provider linguistic and cultural competency. Do they understand that maybe this community doesn't understand Western medicine or doesn't support Western medicine? Maybe they have cultural or aversity to things like blood products, or do they not understand medication use, or do they not understand or want certain types of treatment, or even eating certain types of food because of their community and their culture? So that's something for the provider to be heightenedly aware of, is that maybe they're not seeking opportunities because they don't understand it, or they don't have the culture to support that. They think that goes against their value system. And then the quality of care. So maybe they have opportunities in that community, but maybe the quality of care is not where it needs to be. And so, all of this, as you see, encompasses to health outcomes. So it leads to mortality, morbidity, life expectancy is impacted. The healthcare expenditures can be great if we don't have appropriate health providers that can seek them on an outpatient basis. Maybe they're seeking only ER services because that's all they have in their communities. It affects their health status and their functional limitations. So by working to establish policies and positive influence both social and economic conditions, and those that support changes in individual behavior, we can improve health for large numbers of people in ways that can be sustained over time. So improving conditions in which we live, learn, work, and play, and the quality of relationships will create a healthier population, society, and workforce. So social determinants of health have both direct and complex effects on health. For example, poor air quality, which is more common in poorer neighborhoods, can lead to more incidents of asthma exacerbation. Levels of income and education can shape a range of outcomes, such as the prevalence of chronic disease and life expectancy. The combined impact of social determinants of health indicate the poorest 1% of the population in the United States die approximately 10 to 15 years earlier than the richest. However, it's not just about the haves or the have-nots. The social gradient creates a health gradient. People in the middle of the socioeconomic scale have worse health than those at the top. People lower down the scale have worse, and so on. This means that social determinants of health affect the entire population, not just the poorest or the most vulnerable. In 2011, leading researchers wrote, "A critical mass of relevant knowledge has accumulated, documenting associations, exploring pathways and biological mechanisms, and provide a previously unavailable scientific foundation for appreciating the role of social factors of health." So as we come along, we really realize the impact that these have. As these authors state, the social determinants of health have come a long way, and the scientific foundation is solid. The data suggests that approximately 245 deaths in the U.S. in 2000 were attributable to low education, 176,000 to racial segregation, 162,000 to low social support, 133,000 to individual level poverty, 119,000 to income inequity, and 39,000 to area level poverty. According to the National Academy of Medicine initiative, education level is the most important, powerful determinant of lifelong health prospects. So the U.S. health system is ranked in the World Health Organization assessment only 37th in performing among the 191 member nations in a recent study of the 11 highly industrialized organization for economic cooperation and development nations, and the United States ranked last. The developed nations in the OECD spend on average of $2 on social services for every dollar on health, whereas the United States spends about 50 cents per every dollar on social services. As you can see, the United States has a long way to go in considering and dealing with the true social determinants of health to improve overall population health. One factor that provides results in this area is prevention. This is why it's so important to have research showing the impact of the social determinants of health, and addressing those will actually save money over the long term, preventing hospitalizations and costs of managing chronic illness. So I think we definitely have said, this is where we need to be filtering that money. So I think this goes right in with Biden's administration's prioritization of the social determinants of health in his first 100 days. So he says that he's going to have a policy recommendation during his campaign that will include better utilizing data to determine where we need to filter those funds and policy changes, investing more in community health workers. And I don't know if those of you who have listened to my previous presentation that was community health worker driven, but this absolutely filters right in with that conversation that I had in that previous lecture. Addressing and focusing on hunger and homelessness. I think this is one of the critical pieces of that. So this piece that we did earlier for the presentation about community health workers, I think this is one of the outreach documents, or the documents that kind of put everything together for community health workers. So these workers are great support for identifying social determinants of health and working with the doctors, the community organizations, shelters, and such to combat these issues. So this is where a community health worker could be invaluable at kind of linking these communities of need with resources that are out there that they may not even be aware of. And so linking those services with these patients who are at most need. So President Biden also intends to broaden the Affordable Care Act by expanding Medicaid, which is a great thing. However, we have to look at the other aspect of that too, is are we going to have the access for those patients who are newly Medicaid? Are they going to have room in the healthcare system to be seen? And are these providers going to accept that newly Medicaid patient? They're going to create a new public health insurance option. So hopefully to, expand on the ACA and be able to give a more reasonable cost for the public health option. Right now, folks are getting this public health option, they're paying lots and lots of money for it, and then they have huge amounts of deductibles, so it's really not servicing them the way they need. As well as increasing funding to underserved communities to address these health disparities. So it's going to require more than these things to address those social determinants of health in the long term. President Biden will need to include policy changes on how the health plans, hospitals, community organizations work together to improve health, and include financial incentives that align better with better health and more efficient, effective use of technology. So again, we have we have more to work on than. So this is, I think this slide speaks dramatically to the barriers to care, equality, equity, and justice. And so as you see the document, the image shows, the assumption is that everyone benefits from the same support system, and then that provides equal treatment. So if you can see, we put everybody on the same equal boxes. Well, some can barely see the game, some can't even get in the game. So when we talk about equity, that gets everyone the supports they need. This is the concept of affirmative action, thus producing equity. So we put some on higher boxes, some on no boxes, and some on middle boxes to try to get across the board equity. And then justice. All three can see the game without the supportive accommodation, because we've changed the inequity, we've changed the systemic barrier that has been removed to be able to all get what they need out of the system. So considerations. According to the article, President Biden will need to include policy changes regarding how health plans, hospitals, community organizations work together. The new plan will need to move further to reward quality over quantity. They need to move away from the fee-for-service model and more near a per member per month model, a payment system, and better interoperability between all segments of healthcare. So media, social care, behavioral health care, they all need to be able to communicate effectively. So the more effective plan will reward quality over quantity by incentivizing health plans that work with networks of community-based operations, health systems, hospital systems, and local governments. This will require a digital infrastructure that can easily connect individuals, these community-based organizations, and health plans so that the data can be captured along the way, demonstrating the value of the work that has been performed. This will only occur with interoperability between the many sectors of healthcare, so the medical, social, and behavioral health systems, with the assistance of the U.S. Department of Health and Human Services, the Office of the National Coordinator of Health Information Technology. And it must include a national public-private nonprofit to unify all the regional networks to eliminate redundancy and waste in our social care. These actions will allow us to move away from that fee-for-service model, more near that per member per month payment model that rewards health rather than care. So in other words, we're talking about overall value of the care versus the total number of visits. This would allow us to eliminate our community's overall health by addressing the social factors that account for certain health outcomes. I think that's the one key out of this, is that we need to look at the overall care we receive and how we move forward, all areas, not just some. So here's the resources I used for this presentation. If you have any questions, please don't hesitate to reach out to me. I'll be glad to discuss it. Thank you.